Have you ever felt like your emotions are out of control? Like one moment you're happy, and the next you're deeply sad or angry? For some people, this isn't just a mood swing, it's a daily struggle. Today, let's talk about borderline personality disorder, or BPD. It's a condition many don't understand, but it affects millions of people worldwide. Let's explore what it is, its symptoms, causes, and how life can get better with the right help. What is borderline personality disorder? BPD. Borderline personality disorder is a mental health condition that affects the way a person feels about themselves and others. It's marked by extreme emotional instability, impulsive behaviors, and a distorted sense of self. People with BPD often feel like they are on an emotional roller coaster, with sudden and intense changes in their mood. One moment, they might feel deeply happy, and the next, they're overwhelmed with sadness or anger. This constant shift in emotions can make it hard to maintain stable relationships. People with BPD may idealize someone one day and feel disappointed or hurt by them the next. This pattern often leads to feelings of guilt and confusion. They also tend to struggle with their sense of identity, feeling unsure about who they really are. These challenges make life unpredictable and difficult to navigate. BPD is more common than many people realize, affecting around 1 to 2% of the population. Yet because of its complex symptoms, it's often misunderstood or misdiagnosed. It's important to remember that BPD is not a choice. It's a medical condition that requires understanding and treatment. Common symptoms. Borderline personality disorder has several defining symptoms, though they can vary from person to person. One of the most common symptoms is an intense fear of abandonment. People with BPD may go to great lengths to avoid feeling rejected or left behind, even in situations where abandonment isn't likely. This fear can lead to clingy behaviors or sudden emotional outbursts. Another symptom is unstable relationships. Someone with BPD might have a pattern of intense but short-lived relationships, swinging between idealizing and devaluing the other person. This instability is often tied to their rapidly changing emotions, which can make it hard for others to keep up. They might also experience frequent mood swings, feeling happy, angry, or sad without any obvious cause. Self-image issues are also common. Many people with BPD feel unsure of who they are or what they want in life. This can lead to impulsive decisions, such as quitting a job, ending a relationship, or engaging in risky behaviors. These symptoms often create a cycle of guilt, regret, and frustration, further complicating their emotional well-being. Causes of BPD. Borderline personality disorder doesn't have a single cause. Instead, it's believed to be the result of a combination of factors. One major factor is childhood trauma. Many people with BPD report experiencing neglect, abuse, or loss during their early years. These painful experiences can shape the way they handle emotions and relationships later in life. Genetics also play a role. If someone in your family has BPD or another mental health condition, you might be at a higher risk of developing it. This doesn't mean you're guaranteed to have BPD, but it does show that biology can influence mental health. Scientists have also found differences in the brains of people with BPD, particularly in areas that control emotions and decision-making. Environmental factors, like growing up in an unstable or invalidating household, can further increase the risk. How does it affect life? Living with BPD can feel overwhelming. Everyday challenges, like disagreements or setbacks, can feel much bigger and harder to handle. Someone with BPD might take a small conflict with a friend as a sign that the friendship is ending, leading to anxiety, sadness, or anger. These intense emotions can make it hard to maintain friendships, work relationships, or even family bonds. The instability caused by BPD often affects a person's self-esteem. Many people with this condition feel like they are not enough or that something is wrong with them. This negative self-image can lead to self-destructive behaviors, such as substance abuse, overspending, or unsafe choices. BPD doesn't just affect the person living with it, it also impacts the people around them. Friends and family might feel confused or hurt by the person's sudden emotional shifts. This makes support networks crucial for managing the condition. Can BPD be treated? Yes, and that's the good news. BPD is treatable with the right care and support. Therapy, especially something called dialectical behavior therapy, DBT, helps people manage their emotions better. Talking to a therapist can teach skills to handle stress, build healthier relationships, and feel more in control. In some cases, medication can help with mood swings or anxiety. Support groups are also a great way to connect with others who understand what you're going through. Understanding BPD is the first step toward breaking the stigma around it. By learning and sharing, we can create a world where mental health struggles are met with kindness and support. Remember, everyone deserves to feel understood and loved. If this video helped you, don't forget to like and share it. It might help someone else too. See you in the next video.